Estradiol is deeply and completely connected to cognitive function. When estradiol levels fall, as they do in menopause, many women begin noticing these things like their mental sharpness declining, emotional instability comes about. Why are we spending gazillions of dollars inventing treatments? Let's spend a few small dollars and prevent it from happening in the first place. When we talk about cognitive health, many patients describe challenges like brain fog, declining memory, changes in mood. These symptoms often emerge during menopause transition, and it's natural to wonder whether hormone replacement therapy, especially bioidentical hormone replacement therapy, can play a role in supporting long-term brain health. Estradiol is deeply and completely connected to cognitive function. It supports cholinergic activity, it reduces oxidative stress, and it is extremely neuroprotective. These neuroprotective properties influence memory, clarity, and mood regulation. When estradiol levels fall, as they do in menopause, many women begin noticing these things like their mental sharpness declining, emotional resilience weakens, emotional instability comes about. This leads us to one of the most widely discussed pieces of research in this area. That is, the research surrounding the development of Alzheimer's disease. I want to talk about a study that was done in Cache County, Utah. It is a large population-based longitudinal study that followed women over more than a decade to evaluate how hormone therapy influenced the risk of developing Alzheimer's disease. And you know what? The results are dramatic and compelling. According to the study, women who initiated hormone therapy within 5 years of menopause experienced a 30% reduction in the risk of Alzheimer's disease compared to women who never used hormone therapy. Now think about that. We're doing all of this research to treat Alzheimer's. Why not just prevent it? I want to note to you that the benefit is strongest in women who continued therapy for a long time, greater than 10 years, and it reinforces a concept that there's a critical window in which you need to start these therapies in order to prevent that cognitive decline. That is, hormone therapy, when started early, prevents cognitive decline at its greatest. What I want to let you know is that the study is not exclusively examining bioidentical hormone formulations, but there were a large component of this study, and the findings support the thought that appropriately timed hormone therapy, especially when it's bioidentical hormone therapy with far lower side effects and complications, that these treatments may actually preserve cognitive function and reduce long-term dementia risk. So for patients struggling with brain fog, mood imbalance, or memory decline, these findings offer a great deal of reassurance and expectation of health and vitality throughout your aging years. So when hormones are done properly by experts who know what they're doing, hormone therapy is not just about symptomatic relief. It may play a meaningful and vital role in protecting you well into your aging years and particularly preventing Alzheimer's. Why are we spending gazillions of dollars inventing treatments? Let's spend a few small dollars and prevent it from happening in the first place. I'm Dr. John Carrozzella from the Florida Center for Hormones and Wellness.